Welcome to the official GlobalRPh YouTube channel and our latest presentation, 12 early cancer symptoms you need to watch for. If you haven't already, hit that subscribe button so you never miss out on our latest videos. All 12 symptoms will be summarized near the end of the video. Early detection saves lives. The American Cancer Society, 2023 reports that finding cancer at the original stages can increase survival rates by up to 90% for certain types of cancer. Unexplained weight loss. Unexpected weight loss might be one of the first signs that cancer is developing. Minor weight changes happen normally, but a big unexplained drop in weight needs immediate medical attention. Understanding normal versus abnormal weight loss. Your body weight naturally shifts 2 to 3 pounds because of water retention and hormonal changes. A person who loses 10 pounds or 5% of body weight within 6 to 12 months without trying should raise concerns. This becomes especially worrying when you have adults over 65, as studies reveal that much of older adults, up to 20%, experience unexplained weight loss. Common cancer types associated with weight loss. These specific types of cancer often cause unintentional weight loss. Upper gastrointestinal cancers, including stomach, pancreatic, and esophageal cancers, account for 80% of cases. Lung cancer shows major weight loss in 60% of cases at diagnosis. Colorectal and hematological cancers are also common culprits. Cancer triggers weight loss through several mechanisms. Cancer cells just need more energy than healthy cells and release substances called cytokines that change how your body uses calories. These changes can happen even in early-stage cancers. This is a big deal as it means that weight loss isn't limited to advanced stages. When to consult a doctor. If your weight drops more than 5% in 6 to 12 months without lifestyle changes, you should get a medical evaluation. Weight loss happens among other symptoms like constant fatigue or loss of appetite. You notice changes in eating habits or knowing how to eat. Research shows that people who experience unexplained weight loss are at least 12 times more likely to have cancer than those who maintain stable weight. Cancer isn't the only reason for unexpected weight loss, but early medical help allows timely diagnosis and treatment. Studies prove that catching unexplained weight loss early leads to better treatment results, especially with colorectal, pancreatic, and lung cancers. Persistent fatigue. Constant tiredness might seem normal in our busy world, but persistent fatigue could indicate something more serious. Cancer-related fatigue, or CRF, affects nearly 65% of cancer patients. This makes it one of the earliest warning signs. Different types of cancer-related fatigue. Cancer-related fatigue changes based on treatment types and disease progression. Patients receiving chemotherapy usually experience fatigue days after treatment. The exhaustion from radiation therapy reaches its peak near the end of treatment. Patients on immunotherapy start feeling fatigued within the first few weeks to months of treatment. This fatigue is different from regular tiredness because it affects the whole body and doesn't get better with rest. Distinguishing cancer fatigue from regular tiredness. Cancer-related fatigue shows distinct traits that make it different from normal exhaustion. It continues despite adequate rest and sleep. It substantially affects daily activities. It takes a toll on physical, emotional, and mental well-being. Other symptoms like unexplained weight loss or night sweats often appear. Regular tiredness gets better after rest or sleep. CRF can last weeks, months, or even years. Studies reveal that CRF causes more distress to many patients than other cancer symptoms, including pain and nausea. Medical evaluation guidelines. Patients should seek medical evaluation when fatigue lasts more than 2 weeks without improvement, daily activities become harder, sleep doesn't help, or other symptoms appear with fatigue. Healthcare providers usually perform physical examinations and might order blood tests to check for anemia or other conditions. They ask patients to rate their fatigue levels and keep a symptom journal that tracks patterns and triggers. Research shows that 80 to 100% of cancer patients face substantial fatigue during their illness. Fatigue alone doesn't always point to cancer, but persistent exhaustion combined with other symptoms needs prompt medical attention. Unexplained bleeding or bruising might point to serious health issues, especially certain types of cancer. Research shows that bruising and bleeding appear as early warning signs in 24% of people diagnosed with leukemia. Abnormal bleeding shows up in several ways. Unexplained bruises appear in unusual spots like the back, legs, and hands. Small, pinhead-sized red spots, also known as petechiae, cluster together. Cuts or injuries bleed longer than normal. Unusual vaginal bleeding or spotting occurs. Blood appears in urine or stool. Nosebleeds or bleeding gums happen frequently. Several types of cancer come with bleeding symptoms. People with acute leukemia often see their doctor because of new bruising patterns and petechial rash. More than 90% of women diagnosed with endometrial cancer experience irregular bleeding. Blood cancers, especially leukemia, lead to bruising because low platelet counts affect the body's blood clotting ability. You should seek medical help right away if you notice critical bleeding signs, such as bleeding that continues beyond several minutes, multiple bruises showing up without explanation, bruises staying visible longer than 4 weeks, blood appearing in vomit or stools turning dark and tar-like, vaginal bleeding happening after menopause, or severe headaches coming with confusion. Cancer-related bruising looks different from normal bruising. Regular bruises show up after an injury and heal within 2 to 4 weeks. Cancer-related bruises appear without any injury and take more time to heal. People with low platelets might also develop hematomas that feel like lumps under their skin. Women should pay special attention to vaginal bleeding after menopause. Studies reveal that doctors diagnosed endometrial cancer in 9% of postmenopausal women who experienced bleeding. Skin changes can be significant indicators that something might be wrong with your health, especially when detecting skin cancer early. Research shows that skin cancer will affect 1 in 5 Americans during their lifetime. Healthcare providers assess suspicious skin changes using the ABCDE rule: asymmetry, where one half is different from the other; border, which refers to irregular, jagged, or poorly defined edges; color, with varying shades including tan, brown, black, or patches of white, red, or blue; diameter, typically larger than 6 millimeters, about the size of a pencil eraser; and evolving, meaning changes in size, shape, or color over time. Each type of skin cancer shows distinct warning signs. Basal cell carcinoma usually looks like pearly, waxy bumps or flat, flesh-colored lesions. Red nodules or flat lesions with scaly surfaces are typical signs of squamous cell carcinoma. Melanoma, the most dangerous type, can develop anywhere on your body. It might appear as large brownish spots with darker speckles or moles that change their characteristics. Early detection depends on regular self-examination of your skin. Monthly self-checks are recommended by the American Cancer Society with extra attention to sun-exposed areas. Your self-examination should focus on new growths, changes in existing moles, or sores that don't heal within 4 weeks. You should see a doctor if you notice spots that look different from others, areas that change, itch, or bleed, sores that don't heal within 4 weeks, or moles showing any ABCDE characteristics. Research shows that finding melanoma early improves treatment outcomes significantly. Most melanomas grow under your skin's top layer for some time before spreading deeper. Pain patterns can tell us significant information about health conditions, especially cancer. Research shows that pain affects 59% of patients during cancer treatment. This number rises to 64% for patients with advanced disease. Cancer pain demonstrates itself in several distinct ways. Bone pain shows up as dull, aching sensations in affected areas. Nerve pain feels like burning, shooting, or tingling sensations. Soft tissue pain creates sharp, cramping, or throbbing discomfort. Phantom pain shows up in areas where tissue has been removed. Referred pain means patients feel pain in a location different from its source. Pain's location and characteristics give valuable clues for diagnosis. Studies show that 28.2% of breast cancer patients report pain. Head and neck cancer patients often experience localized pain as an early warning sign. Research has found that pain was the main indicator of squamous cell carcinoma invasion in organ transplant recipients. Medical teams assess cancer-related pain using specific criteria. Doctors rate pain intensity on a scale of 0 to 10. The scale breaks down into mild, which is 1 to 3, moderate, which is 4 to 7, and severe, which is 8 to 10. These factors help create a full picture: how and when the pain started, where it hurts and how intensity changes, what makes symptoms better or worse, and how it affects daily life and sleep. Cancer pain is different from regular discomfort. The pain often continues without clear reasons and might not respond to regular treatments. Studies indicate that younger patients feel pain flares more often than older ones. Medical evaluation becomes vital if pain appears among other symptoms like unexplained weight loss or constant fatigue. Changes in your bowel and bladder habits might reveal important signs of health issues, including various types of cancer. Studies show that 40% of patients with certain cancers notice changes in their bathroom routines before getting diagnosed. Your bowel and bladder patterns naturally vary sometimes. Diet, medication, or stress can cause temporary changes. But changes that last more than 2 weeks need medical evaluation. Research shows that bladder cancer patients often need to urinate more frequently and urgently, especially at night. Doctors point out several concerning changes that might indicate cancer. For urinary changes, frequent urination, especially at night, pain or burning during urination, blood in urine, whether visible or microscopic, and a weak urine stream or trouble starting flow. For bowel changes, blood in stool, whether bright red or dark, ongoing diarrhea or constipation, narrow, pencil-thin stools, and unexpected urgency or frequency. Current guidelines strongly suggest regular colorectal cancer screening starting at age 45 if you have average risk. You should start screening earlier if you have higher risk factors like family history or inflammatory bowel disease. Early detection through screening can substantially improve treatment outcomes. Doctors diagnose colorectal cancer in about 152,810 Americans each year. Some symptoms need immediate medical attention, especially blood in urine or stool, which shows up in 80% of bladder cancer cases. These changes often stem from less serious conditions like urinary tract infections or hemorrhoids. But symptoms lasting more than 2 weeks should prompt a doctor's visit. Research shows colorectal cancer rates keep rising among younger people, with new cases increasing 3.8% yearly in the 15 to 39 age group. This trend shows why you need to recognize early warning signs, whatever your age. Swallowing problems can point to serious health issues, especially when symptoms don't go away or get worse. Medical research shows dysphagia affects up to 80% of head and neck cancer patients before they start treatment. Swallowing difficulties usually follow a clear pattern. Patients might notice mild symptoms when eating solid foods. They often adjust their eating habits without realizing it by taking smaller bites or chewing more carefully. The symptoms get worse over time, and many people switch to softer foods and eventually move to liquid diets. Research shows dysphagia can substantially affect someone's quality of life, and many patients end up feeling socially isolated because they struggle to eat. Different types of cancer can lead to swallowing problems. Head and neck cancers, including thyroid, laryngeal, and oral cancers. Esophageal cancer, often causing progressive difficulty with both solids and liquids. Brain tumors, which may affect nerve pathways controlling swallowing. And lung cancer, which can cause pressure on the esophagus. Research reveals that esophageal cancer patients usually start with mild dysphagia, but symptoms become more severe as their esophagus narrows. Studies show 60 to 80% of patients with upper gastrointestinal cancers face substantial swallowing difficulties. Doctors use 2 main methods to evaluate swallowing problems: the Modified Barium Swallow Study, MBSS, and the Flexible Endoscopic Evaluation of Swallowing Fees. MBSS uses live fluoroscopic imaging to check swallowing physiology. FEES involves passing a flexible endoscope through the nose to look at throat structures. These tests help doctors pinpoint the exact cause and location of swallowing issues so they can plan proper treatment. People should see a doctor right away if they notice frequent coughing or choking while eating, unexplained weight loss, or recurring chest infections. Cancer patients might find their swallowing problems get worse during treatment. Studies indicate that radiation therapy can permanently change how someone swallows. People make over 30 million visits to healthcare providers each year because of persistent coughs. Most coughs don't cause concern, but certain signs might point to more serious conditions, including cancer. Doctors group coughs into 3 time frames: acute, less than 3 weeks, subacute, 3 to 8 weeks, and chronic, more than 8 weeks. Research shows that about 57% of lung cancer patients notice coughing as an early warning sign. Cancer-related coughs are different from regular respiratory infections, and often show up as a dry, persistent cough with no clear cause, a cough that gets worse over time, blood or pink-tinged mucus when coughing, chest pain with coughing, and night coughs that interrupt sleep. Your risk of a cough indicating cancer increases with certain factors. The data shows that long-term smokers face substantially higher risks. Smoking leads to more than 80% of new lung cancer cases in women and 90% in men. Environmental elements play a significant role too, such as exposure to secondhand smoke and workplace hazards. Doctors suggest getting checked right away if your cough lasts beyond 8 weeks. You need quick medical attention if you have asthma or COPD and notice changes in your cough patterns. Critical warning signs that need immediate medical help include coughing up blood, sharp chest pain, and trouble breathing. Doctors get into factors like cough duration, related symptoms, and medical history during evaluations. Research reveals that half of the patients with early-stage lung cancer notice cough symptoms before diagnosis. The good news is that nowhere near 2% of chronic coughs point to lung cancer, but early evaluation remains vital to get the best treatment results. Night sweats and unexplained fevers are often the first warning signs of certain cancers that people miss. Medical research reveals these temperature changes can show up months before other symptoms appear. Temperature changes linked to cancer usually follow specific patterns. The Pell-Epstein fever, which doctors see in Hodgkin's lymphoma patients, shows up for several days and then disappears for a similar time period. This cycle typically lasts 7 to 14 days. These cancer-related temperature changes don't usually get better with regular fever medications. These types of cancer often come with fever or night sweats, leukemia and lymphoma, both Hodgkin and non-Hodgkin, liver cancer, mesothelioma, bone cancer, carcinoid tumors, and kidney cancer. Research shows that doctors link much of unexplained fever cases to hidden cancers. Blood cancers stand out because they show clear temperature patterns, and night sweats often appear months before diagnosis. Temperature monitoring has improved by a lot with modern methods. Recent studies reveal that wearable temperature sensors can spot dangerous complications 5 hours earlier than regular monitoring. Healthcare providers suggest taking temperature readings every 2 to 3 hours when symptoms appear, recording any temperature of 100.4 degrees Fahrenheit or higher, documenting when night sweats happen and their pattern, and writing down any other symptoms. Patients should see a doctor if they experience drenching night sweats that interrupt sleep, or if fever patterns last more than 3 days without an obvious cause. Research shows that cancer-related fevers are different from infection fevers because they usually don't cause chills or rigors. Studies using continuous temperature monitoring have found that spotting temperature changes 12 hours earlier than usual methods can improve treatment results. This early detection is vital, especially when you have patients with weak immune systems. Early cancer detection significantly improves survival rates. Research shows survival rates can be up to 90% higher for some cancers detected early, according to the American Cancer Society, 2023. Medical professionals highlight 12 warning signs that need immediate attention: unexplained weight loss, persistent fatigue, unusual bleeding, skin changes, chronic pain, bowel or bladder changes, swallowing difficulties, persistent cough, fever or night sweats, mouth changes, unusual lumps, and digestive system alterations. Patients who identify and respond to early warning signs have better treatment outcomes in various cancer types. A strong early detection strategy combines regular self-examination with scheduled medical screenings. Any symptoms that last more than 2 weeks or appear with other warning signs need immediate medical evaluation. These symptoms don't always mean cancer. Many conditions have similar warning signs. Quick medical consultation helps healthcare providers evaluate and start treatments early. Research shows early-stage cancer treatments need less aggressive interventions and patients have a better quality of life during recovery. Healthcare providers emphasize the importance of regular checkups and staying alert to body changes. Medical evidence confirms that awareness of warning signs combined with routine screenings provides the best protection against advanced-stage cancer diagnosis. Some common early warning signs include unexplained weight loss, persistent fatigue, unusual bleeding or bruising, changes in skin appearance, and ongoing pain. However, these symptoms can also be caused by other conditions, so it's important to consult a doctor for proper evaluation. Cancer-related fatigue is typically more severe and persistent than normal tiredness. It doesn't improve with rest, significantly impacts daily activities, and often affects physical, emotional, and mental well-being. If fatigue lasts for more than 2 weeks without improvement, it's advisable to seek medical attention. Pay attention to new growths, changes in existing moles, or sores that don't heal within 4 weeks. Use the ABCDE rule. Look for asymmetry, irregular borders, color variations, diameter larger than 6 millimeters, and evolution or changes over time. Regular self-examinations can help detect potential skin cancer early. A cough lasting more than 8 weeks, especially if it's accompanied by blood and mucus, chest pain, or worsens over time, should be evaluated by a healthcare professional. While most coughs are benign, persistent coughing can be an early sign of lung cancer, particularly in smokers or those exposed to secondhand smoke. Regular dental checkups are crucial for early oral cancer detection. Dentists often perform brief oral cancer screenings during routine visits, examining the mouth, lips, face, and neck for potential signs. Biannual dental screenings are recommended for optimal prevention, as early detection significantly improves treatment outcomes for oral cancers. Thank you for watching our GlobalRPh production. If you found it enjoyable and informative, please consider liking the video and subscribing to our brand new YouTube channel. Our content spans a wide range of topics designed to appeal to a diverse audience, ensuring there's always something fresh and engaging for everyone. Your support helps us grow and continue to provide interesting and valuable content. Stay tuned for more exciting videos.